Hello, this is Christian Espana-Schmidt, MD, and this is I Am Focused. We are going to talk about lung ultrasound, this time normal pleural sliding and pneumothorax. In this case, we are seeing normal pleural sliding. The pleura is being evaluated with a linear array probe. The marker of the probe is cephalad to the patient, and we have here the pleura, this hyperechoic line that you can see moving back and forth. Everything below the pleura is an artifact, so it's not a real structure. You can see some reverberation below the pleura, which is equivalent to the A lines. Then, for context, we have a rib and its echogenic shadow, as well as the skin and subcutaneous tissue. To evaluate the pleura, the best probe is the linear array if you are looking specific or for disease of the pleura. The pleura also can be evaluated in M mode. This is an M mode of the pleura, and here we have the pleura. For reference, again, the rib and its acoustic shadow and the skin and subcutaneous tissue. Now, in M mode, we have the skin and subcutaneous tissue not moving, so it looks like parallel lines, just like a barcode. Then you can see the line of the pleura, and everything below the pleura looks like a degraded image. And this degraded image is just the pleura going back and forth with its artifacts, looking like a seashore, hence the seashore sign. This is how the normal evaluation in M mode of the pleura should look like. We can see here the M marker right in the middle of the pleura. Now we are going to talk about long point. Long point is one of the most important signs of pneumothorax. In this case, we have the same patient after a procedure, and this patient has developed a pneumothorax. As you can see, this is the skin and subcutaneous tissue. Then, for reference, we have a rib. Then we have the shadow of the rib. And we have a portion of the pleura going back and forth in our screen. Now note that after a point there is no movement and there is reverberation, just like A lines. However, there is no movement. And we have here the long point. If you find a long point in this type of circumstances, this is almost pathognomonic of pneumothorax. As you can see, noted before, there is no pleural sliding. This is the same area and the same patient interrogated before. The pleura again can be evaluated in M mode, and in this case I have placed the marker after the long point. So we have the pleura here, the rib again for reference with the acoustic shadow, and the skin and subcutaneous tissue. You can see again the skin and subcutaneous tissue not producing any movement and looking like parallel lines in M mode. However, this time, after the pleural line, there is no degradation of the image, and you can see the lack of motion, again looking like parallel lines, and this is called Oh, and by the way, this is the marker, M marker. This is where I place the marker for the M mode that we are seeing. And this is called the barcode sign. It's called the barcode sign because it looks like a barcode. So there is no motion, and you can see that after the pleura, everything looks like parallel lines. It's also called like the stratospheric sign. And you can see that this is different from the seashore sign. In our last slide, we have again pleural movement that is normal. So in this case, we see the pleura right there. This is area 1. We can see a rib. We can see the acoustic shadow of the rib, skin and subcutaneous tissue. We see another rib. This is a longer probe than the first one. The marker is always cephalad, and the rib has its acoustic shadow. Now you can see B lines. So if you see B lines, you can be certain that you have ruled out the presence of pneumothorax, at least in the area that you are evaluating. Pneumothorax is easier to find in areas 1 and 5, or the apical areas of the lung.